Good to go.
Yeah.
Parvi, you want to start?
Yeah, so let me just set a context for everyone. First of all, welcome all for this exclusive webinar. And it's going to be very insightful for all of you. And I'm sure you're going to have a lot of takeaways. So, yeah, and I just request everyone for the initial 45 minutes to please, turn off your video and audio, because we are around more than 150 participants live right now, which is really very great. So while we have a Q&A session, so let's, during that time, let's just make sure to turn on our videos. And yes, over to you, Bhushan.
Thank you, Parvi.
Yeah.
Thank you to all the panel members. What I would do is I would quickly introduce the purpose of this event. As you all would have gone through it, we at Johnson & Johnson understand this is the journey of motherhood continues to be the toughest journey. But with my mom around and my wife here, I also understand this is the greatest journey to be a part of. And at least in this lifetime, I am not the fortunate one. All the ladies here, I salute to your motherhood journey and to your family members. This was to explore more and understand from the panel of experts present here about the motherhood journey and how together we can make it more of joy and less of pain. Without wasting much time, I would also like to thank BabyChakra here for taking the partnership forward. And I would like to introduce Naya, who also happens to head BabyChakra. Thank you, Naya, for setting BabyChakra in India. Over to you.
Thanks so much, Bhushan. And, thank you, of course, to our panelists who we'll proceed to introduce in just a minute. But first of all, thank you to all the amazing, amazing mums. And I see some dads and healthcare practitioners. I can see a few folks who look like doctors joining in. It's special because I think, it's lovely, first of all, to see so many different faces and not just sort of see your own immediate family's face all the time, because you're all sort of cooped up at home at this point in time. But more importantly, you've taken out the time for yourself to inform yourself on how to make a better choice, a more empowered choice. And for that, I mean, congratulations. You're investing in yourself in coming in for the session, and you're also sort of taking the time out to listen to us. So I really want to thank you for that. Without much further ado, because we want to keep this tight and open it out for questions at the very end, I'm going to do a quick round of introductions to our amazing panelists. We have some really a very interesting mix, actually. So I'm going to start off with actually Dr. Vandita, who's got a very interesting background, actually a physician by education, and then went on to do her MBA. So, I mean, clearly, like, a lot of effort gone into your education, Dr. Vandita, but clearly, I think also shows sort of, your leanings towards really making a change in the business of healthcare. Vandita has 17 years of experience as a leader, and she's currently leading the Ethicon Wound Closure and Biosurgery Division at Johnson & Johnson, South Asia. Dr. Vandita is also a big champion of diversity and inclusion, which, by the way, Dr. Vandita is a very big cause that BabyChakra really believes in and supports, and of mental health, which, of course, today in the middle of this pandemic has come to the forefront. But more importantly, I think at this point in time, what Dr. Vandita is on the panel for is as a physician, as a change agent, and also as a happy mother. So Dr. Vandita, how old is your little one? Just as context.
Well, my little one is an old one now because she's
Sorry, I didn't catch that. Your voice broke.
she's 15. She's a happy teenager.
Okay, she's a teenager. Super,
Yeah.
super. Great. I'm going to move on next to introduce Dr. Niraj, and Dr. Vandita, we'll hear more from you across the day. Dr. Niraj is again, I think, an extremely accomplished a practitioner. He's a senior gynecologist, obstetrician, and laparoscopic surgeon in Hyderabad. He has trained widely in India and the UK. And doctor, you have more than 22 years of experience in the specialty of obstetrics and gynecology. So, looking forward to hearing more of your expertise come through on this panel because, we're talking about innovations in healthcare. And who better than you, who's actually there on the field, working with mothers daily, to tell us what this means for mums like us?
Sure. Thank you
Thank you,
for
Dr.
being
Niraj.
part of this wonderful event. Yeah, I look forward to giving my experience and sharing my views about this wonderful topic which you have chosen for today.
Super. Thank you. And of course, last but clearly not the least is Harpreet, who's better known as Mom Wears Prada. I'm sure a lot of you follow her on Instagram. She has been tagged as the next big thing by Miss Malini. She's one of the most influential mom bloggers in the country. She was also recently known as India's COVID mom warrior by the Hindustan Times. So clearly, a lot of amazing work being done. Not just the typical like the perception of a mom blogger is always taking selfies, but clearly a lot of good work is being done by influencers, by bloggers, and Harpreet clearly are no exception. And Harpreet, remind us, you have two little ones, right? And these are actually little ones, unlike Dr. Vandita's.
So my elder one is 10 now, and my little one is 4.
Okay.
But they're very
wonderful,
little for me.
Wonderful. As they always would be for all of us. So we're going to dive right into it because, this is actually a very interesting topic. Hi, did we? Okay. So this is actually a very interesting topic. So, the topic of the discussion overall is motherhood, the greatest and the hardest journey. But if you really step back and you say, during the period of pregnancy, or even when you're considering being pregnant, and we've done the survey on BabyChakra every month. We have about 3 million mothers use our platform, right? And very, very, very engaged way, very voracious way, right? They're reading all the content, etc., on what it means to be pregnant, what is life after pregnancy, what is life through pregnancy. But the most searched about piece is the labor pain period, right? Everyone's talking about labor pains. Everyone's talking about, C-section hoga, ki natural delivery hoga. And in fact, if we've looked across surveys and we've done surveys, but about 80% of mothers who are pregnant or thinking about pregnancy are most worried about the labor period, right? But it's very interesting because, one of the big myths we want to bust right now, and this has come through, I think, of course, personal experience, but I think the professionals will also tell you that it's not the toughest period probably, and I don't want to scare anyone here, but one of the toughest periods is actually the post-delivery period, right? Because post-delivery, if you have a natural birth or if you have a C-sec, right? Everyone says normal delivery karna hai. Well, there's no abnormal delivery per se, but chalo, natural delivery bol dete hain. Natural delivery or C-section. I mean, बहुत overwhelming period होता है for mothers, right? So I want to talk a little bit and get really behind the scenes there thoda sa. Harpreet and Dr. Vandita, I want to understand from you because, yes, you are influencers and you're physicians, but first you're mothers, right? What were you expecting labor to be? And how painful was it relative to what you experienced post-labor? And maybe, two things that really surprised you that you want to tell with all the mothers here, the 200 mothers here, that, they should know about when they think about the labor period and the post-labor period. Harpreet, you want to go first?
Okay, it's funny story maybe, so I'll tell you. So I thought I had gone through histro, lapro, everything possible right before my pregnancy. So I thought I was a champion of pain and my thresholds are very, very high. So labor is going to be like easy for me. But when I went in, so I never went in labor per se. I kept waiting and my doctor surprisingly...
ठीक है, चलो बिमनाम आई तो फिर जमा.
Could we have all of us, the rest of us, please be on mute?
So my doctor dreamt of me, and she called me to the hospital saying that I've dreamt of you and I think you just now need to deliver. So, we had that bond between us. And she's like, I've never dreamt of a patient, but I've dreamt of you. So I went in. We kept trying for, ki labor ho jaye. Then we put those injections that you give in to induce labor. We went through everything. I was just not diluting and the labor was not starting. However, labor came. I thought it's going to be easy for me because I have been through everything, in terms of pain. But it was, I shiver when I think, but my labor happened. I was not dilating. Then my doctor told my mom-in-law that she needs to get a cut, C-sec, and just finish it now because we can't risk it anymore. My child, my first one, ate poop in distress. It was a very dramatic story. And then my mom-in-law was fighting in the labor room. No, humko to normally karana hai. Hum to nahi karayenge C-sec. And she's saying, kuch ho jayega, wo mar jayegi, she'll die. And my mom was like, no, nahi karana hai. Usko aur pain, let it happen. She will, wo thak jayegi. And finally she will push. I was like, go to hell, everybody. I need to get this baby out right now. I'm dying of pain. So this was my first one. Second one, I thought, now I'm a champion. Now, nothing can come in between. And I have, mastered the art of having a child. And so it was again C-sec because we had decided, I thought C-sec was much better than going through that pain that I went through of 8 to 10 hours. And my second one, I thought I'm a champion. I called all my friends over once, I came back from the hospital. My stitches, one of my stitches broke. I even developed an allergy. I started itching there, on my stitch. So I realized that day that, we all need to rest. And I'm telling this to all the moms here. We might feel we are superhumans, we can manage everything. But and my doctor said, Bache, you need to rest. You need to give your body time to heal. You're not a superwoman. None of us are, we all, everybody body is same and everybody needs to rest. So many very dramatic stories, dono. And I didn't see my friends or pick up any call for next 20 days. I get lost. I just need to rest and just make my body heal itself. So yes, body condition stitches the mere so very bad time.
Very interesting. Very interesting. And Vandita, Dr. Vandita, did you have a normal delivery? Well, again, I want to say this is nothing is a normal or an abnormal delivery. So I want to do away with that. Did you have like a natural birth or did you have a C-section? And what was your experience?
Naya, first of all, call me Vandita. I think that's more comforting.
Okay, will do.
Comforting, right? So
okay, done.
Yeah, and my story is very different from that of Jaspreet. Okay, so I had a normal vaginal delivery. Unlike you, Jaspreet, I think everyone starts reading about labor expecting it to be painful. But during my entire pregnancy, I think I approached the subject of childbirth with a lot of nonchalance. I wanted to keep it very simple in my head. I wanted the process to be as natural as possible, both in my head and physically. I worked till the last evening before I got induced the next morning. I chose not to take any childbirth classes, no counselors. Sorry, I'm not saying that this is the right thing to do, but that's what I personally chose. While I look forward to my labor with excitement, I do accept that I flipped through those labor and delivery chapters of that book, What to Expect When You're Expecting, during those final months, when there's never ending insomnia, you can't sleep. But honestly, that didn't help me much. And I'll tell you why. Because what kept popping up in my head were those bad situations from my days of being a physician. And you know what I used to do? Every few days, I used to think of those bad situations and I used to call my doctor back and guess what? Not for advice, to give her advice, right? And that was coming from me being a doctor myself. So I used to ask her, see, if stage 3 labor gets prolonged by about 30 minutes, don't take a chance. Please take me for a C-sec, okay? Or I'll say, do you want to do the sonogram for the baby one more time? Just check baby's head and shoulders. If they're too large, maybe you can, that would help you plan the episiotomy well in time, So my doctor, she of course is a senior and a very good hand. And, God bless her for her goodness. She never told me that, lady, look, you don't tell me what to do. I know my job, right? So those were the kind of experiences I had during my labor. But the moral of the story is that I think when we read about all of this, of course we should be aware, fully aware. But then fully should only be basic, right? Let's not try to be doctors. It's something that I really want to emphasize, especially in these times of the pandemic, when everyone believes that they hear pieces of news on a channel or Google it up and they become semi or equal to doctors. So knowledge about the birthing process, including the C-sec, is critical, but let's not try to be doctors. And on a couple of things, if we do have time, I think I want to cover one experience from the journey of being pregnant, and the second, which is post pregnancy, right? So I think what I want to tell moms to be is that while you're pregnant with your baby, also be pregnant with a positive attitude. Do not stress about what you do not know, and do not stress about what others are telling you. ऐसे कर लो, वैसे क्यों नहीं किया? Not to say that do not stay aware, but I would say encourage a trustful relationship with your doctor, with your own family, and this would give you a sense of control. It would increase your confidence as a new mother. So that's on pregnancy. And on the post-pregnancy period, I think nature fully supports us in the process. You naturally learn to be a mother every day, from feeding, deciphering, and managing the sleep routines to weaning your babies. You soon realize that you understand motherhood much more than what your doctor told you, right? Those nuances. And then just trust your maternal instincts and enjoy the journey. So that's what I would say.
Thanks for that, Manita. And I think it's interesting, right? Because I'm hearing two mothers, and that's just the reality of it, right? Motherhood is not the same journey for everyone. There's a common bond, but it's not the same journey. It's a different set of experiences, and I think that's what makes it so exciting. Dr. Niraj, I want to come to you very quickly here because when consulting with mothers, right, on their on their sort of worries, right, what comes out as the most, when they're pregnant, what comes out as like a cause of the greatest worry? And now that you've sort of worked with and sort of supported and had so many children come to the world because of your efforts, right? I mean, what do you think you would want to inform them now about what to be really worried about or what to be really cognizant of?
Right. It's interesting, actually. I might just touch upon those two friends of ours, Harpreet and Vandita, what they said earlier. Now, unfortunately, both of you started off with a little unfortunate situation by not getting it for yourself. The best way and the most women, what they should expect is the labor pains should start naturally. The moment you are in that position where the labor pains are starting naturally, your chances are way high up of achieving a normal delivery. But the moment you get induced, the moment we try to be Mother Nature, we put our hand up and say, hey, Mother Nature, you're not doing it, I'll do it for you. And then when doctors start interfering by giving you medications or putting you on drip and trying to make you go in labor, that's where things start going slightly wrong. This is not philosophy, this is even science. Women who we start off inducing, as Vandita said, start inducing you, the risk of cesarean section goes high up. Good, you did well to achieve a normal delivery. The chances of cesarean section or doctors interfering, when I'm saying doctors interfering, I mean labor is a natural process. Most of the times we would want to step out of the whole process and let it all happen naturally in a nice way. But only if we identify problems, then we do obviously interfere and take a decision whether to go ahead with the cesarean section or do an instrumental delivery. I don't want to get into the technical aspect, but yes, both of you, I think, started off with a little disadvantage of not getting in labor yourself. Harpreet ending up with infection and the wound opening up, that's really unfortunate. That doesn't happen in modern obstetrics. In fact, the place where I practice now and even earlier in United Kingdom and now Rainbow Hospitals, we actually aim for 0% surgical site. And the audit that there is 0% surgical site infection, which means the area where we do surgery, there should be no infection. That's what we aim for. And fortunately, we've been achieving it way high, almost 99 to 100% in last whatever few months or years. Now, coming to your question, Naya, sorry, I forgot. What did you ask? You asked, what are the main anxieties which I face about women in my day-to-day practice? Now, I see all different kinds of variety of women. There is a group of women who have read everything about it. They have Googled. They believe they are half doctors. They believe they're almost there because they know the stages of labor. They know how to cope with labor. They know what to do after delivery. But unfortunately, that is the misplaced concepts many times. It's not that easy. You don't read Google and be prepared to get into labor and deliver and have a nice time.
Doctor, you're on mute.
Oh, sorry.
Doctor, you've just gone on mute. Yeah, no worries.
It's the last two lines.
Okay, sorry. So I thought I was talking to myself. So you might have heard even posh to push. That's a very standard, very well-known phrase. And I would imagine, no offense, but Harpreet, I don't know if you were in that category of women or Vandita was in that category of women where you were too scared to push. But from what I hear, I don't think you were. You were quite motivated to have a normal delivery.
For the first one, I was looking forward.
Yeah, sure.
And I thought I'm very strong. And instead, my sister-in-law, who's very petite and very skinny, she had both normal. And I am little robust. And I had both C-section. I thought, strong women can easily do, again, go University of Google. You feel that?
Most of the times I do tell women not to blame themselves for not achieving a normal delivery, because not everything is in your hands or even doctor's hands. For example, if the baby puts itself in an awkward position where it's not going to negotiate with, when it's not going to come through your pelvis, it's not meant to be, that's it. So no matter who you are and how much motivated you are, it will not happen. So there are ways where we have to pick up that nature is not really helping here, and we interfere and do cesarean section. So having cesarean section should not to demotivate women. Most of them do feel a little demoralized at the end of the day. They start suspecting, they have some self-esteem going down, thinking, oh, I was so motivated, I couldn't achieve a normal delivery. The point is, don't feel too much, don't think too much about it. Not everything is in your hands. You gave your best shot, that's it, well done. And as far as motivating women, yes, throughout the 9 months when we see women in the outpatients, I keep talking to them. I keep telling them about what they're looking at. It's a gradual process. You can't suddenly see a mom today morning and say, you're having normal delivery tomorrow, and I'll give all the best motivation that I can possibly give. It doesn't work like that. It's a slow process. You have to work on them throughout their visits with you, develop that rapport, let them have that trust on you that, yes, this doctor, I trust him, and he's going to take care of me in labor. And one important thing, both Vandita and Harpreet did not mention about is the pain relief. We have got some beautiful anesthesia these days, analgesia, the pain relieving methods. I don't think we have time to go into those details, but the anesthetists, my colleagues here who are here 24 hours with us in labor room, they make sure that these days women don't get pain. I mean, most of the corporate hospitals, most of the good hospitals wherever you are, should be offering what is called epidural analgesia, which is a needle in the back. It takes away the pain. It makes your journey through the process of labor very well. So the contractions don't stop. The process of labor doesn't stop, but you remain pain-free. So you laugh through your labor. That can also happen.
I want to ask you,
Niraj,
I want to ask something here, doctor. There's a very big myth. I know it's off topic, but a lot of women are pregnant here, and I really want you to answer this. Does epidural lead to lifelong backache? This is the biggest myth I've heard. I don't know if it's myth or not. You please guide us on that.
I'm so happy you mentioned that, because that is a myth. I mean, no matter how much we try and tell them this is not true. I mean, in the Western world, in the United States and in UK, from where I come from, I had my training in south of London, all my training leading to CCT. It's a very, very popular, it's a supreme form of analgesia, if I may say. Women take, and a simple logic, if it was so harmful, if it was going to cause you damage to your back lifelong, do you think those countries would have practiced? Would we have inherited that kind of science in our own women here? And one more important thing is, what women need to understand is the backache which they get is because of the pregnancy itself. The pregnancy does the damage. It's not the epidural. So you'll see many women who never had an epidural, who never had any spinal anesthesia, but they are left with backache for long term. There are two reasons for that. One, pregnancy itself does cause a significant damage to your spine all through that 9 months, when it is carrying a whole 3 kgs of baby on an average, a liter of fluid, placenta, the uterus, all that drags on your spine. So essentially your anatomy, the normal shape of your spine, is altered for good last 6 or 7 months of pregnancy when the baby is growing. That does the damage, one. Second, most women, especially in this part of the world, where in India, I'm generally saying, of course, now I should not generalize it too much, but not many women look after their health after birth of the baby. They're too busy looking after their babies or with housework and things like that. But they don't do physiotherapy. They don't do any abdominal exercises. They don't really try to get back to their normal shape. That leaves them with backache. So there are two reasons. One, summarizing, one, the pregnancy does the damage. Second, the way they look or don't look after themselves after birth of the baby. Now, my wife is not here, actually. I mean,
And I think that's a beautiful.
yeah, no, just one second. Dr. Amrita, she's my
Sorry
wife.
to interrupt. Yeah.
Anesthetist. She does give these pain relieving medications, epidural analgesia, and we do discuss about this in good old days. We used to discuss about how it works and how it benefits. And we can see when we are working on labor ward together, we can really see how women, suddenly they're different people. Before an epidural analgesia, you see them, and after an analgesia, you go and see them. That lady is a different lady, because then she's talking, she's laughing, she's asking questions. Earlier, she would have been only screaming and shouting in pain. So that's a very nice pain relieving method. Sorry, go on.
So Dr. Niraj, before Neha moves on to the next topic, I just wanted if you would allow me to endorse what you said. Because I think me and my mom, we've been 2 generations of beneficiaries of epidural. Both of us took that. And my mom, she's closing 75 now. She's good, thankfully. And that was 4 decades ago, coming again from London when she got an epidural anesthesia there. And I was convinced I want to get it myself. So just wanted to endorse that. Thank you.
Thank you.
Yeah. And I think just moving on from there, because I mean, I think absolutely same here, right? I had epidural, and it was the miracle for me, right? In a very painful time. But I think I want to move into the segue, Dr. Niraj. It's an important segue you've talked about, which is what happens post-birth, right? And this whole thing about women not being able to either function in a normal way, or if they have stitches, right? If they've had a C-section or even a normal, in many cases you do have stitches, small stitches, but nonetheless you do have some stitches. So tell us a little bit about that, because after birth is actually one of the most important times, both for the mom and for the baby, right? You're breastfeeding, you want to get back to a sense of normalcy, you just want to have a basic shower, if nothing else, right? You've just gone through this life-changing experience, and you've come out from the hospital. So what are your thoughts there? I mean, what do you see as the most important barrier post-delivery for mothers to regain and come back to normalcy very rapidly?
It's a very important question. I'm happy you asked me that question. 2 things I would say. One, how well the woman, I won't call them patients. I hate calling pregnant women patients, because that's a physiology. They are not patients. They're not unwell or diseased ladies. So all these women who are pregnant or post-pregnant, one most important which I have realized is how well they are primed during their pregnancy for the post-delivery period. Again, goes back to my point about you're not going to make them overnight ready for post-delivery days. You should be talking to them even when they are pregnant about what kind of challenges they might be meeting in a light way, not to scare them, not to get them anxious, but gradually get them into that tone and get them mentally prepared to the challenges they might face. Just 1 or 2 points I would say. In the current pandemic situation, things have gotten worse, because we've got a lot of migrant population where I work here, and their parents are, the clients here I have are from all over country, most of them from North India, some of them from even Calcutta and as far as Assam. Now, their parents are there. Generally, Indian families will come together, parents will come down and help post-delivery. Now here, because of pandemic, all the parents or most of them are not able to come. So they're left with husband and wife looking after the baby, not prepared at all. So that is how pandemic has affected very badly. Now, going back to generalized question, if I look at how they cope with the pain or don't cope with the pain, it depends upon whether they have had a normal delivery or a cesarean section. The best thing about normal delivery is next day you are up and about, you're doing all your work without any problems, assuming you didn't have a bad episiotomy or a tear. If it was no big tear, a small little cut down below to assist to ease the delivery of the baby, and we've got some nice stitches these days coming up which are nicely antibiotic coated, and they're very smooth on the skin, they're very smooth on the tissues, they don't cause much of pain, and that does make women recover very quickly after their childbirth. Cesarean section, normally third day, 48 to 72 hours, I send them home and they're up and about. They'll be taking shower the third day or fourth day, maximum fourth day. Third day, they're up and about and taking shower. So mental preparation is one thing. Second, physical discomfort or comfort. Now, unfortunately, there will be, no matter how much a doctor is good or a hospital is good, there will be one odd occasion where someone might end up having a bad infection or a wound opening up or a swelling around the wound, and that might cause discomfort and pain. But again, there are some very good pain relieving medications which we can give and make women comfortable so that they can kind of cope with that pain. But we wish and we always aim that it doesn't come to that they need a lot of painkillers. So yeah, two things. One, psychologically, how much they're prepared
Got
for.
it.
The second, physically, how much they are in pain or no pain following their normal birth or a cesarean section.
Got it. That's really helpful. And, I want to come to you, Vandita, right now, because I think one thing that, when we were chatting the other day, right, Harpreet, Dr. Niraj, you and I, and I think what really caught me and what I think really got our attention was the fact that, we're moving forward. I think Dr. Niraj and you also talked about like the role of, for instance, epidural, right? How it's relieving pain during the labor process. Now, the whole I think introduction that you were talking about and the sort of the femtech developments you're talking about in terms of even the stitches, I think technically they call sutures, right? The stitches that, you can put on your C-section, or like if you have like any sort of operative procedure during birth, how they are, I think Dr. Niraj mentioned antibacterial coated. So I think, what Harpreet went through, the infection or any sort of allergy, that doesn't happen anymore. But I also saw this very interesting new innovation, this glue gun, right? This glue that you actually put on your wound, and I was just completely bowled over by that. So tell us a little bit about that, because I think one thing we're all very passionate about is that, and we feel right that technology in many ways has not really thought about women's needs. It's not put women front and center, right? So I want to know more, and I think all of us want to know more about what are these innovations and what does it mean for us as women,
Sure,
like
sure,
post labor and like
sure.
hospital room.
So Naya, you'll have to give me about 3 minutes to finish this, because look, the entire experience of birthing, especially the first 15 days after the baby is born, it's hugely multidimensional, right? And what we're talking about it is making that whole period better, safer for mothers. So I don't want to emphasize on just the products here, but I do want to get behind it and talk about where did the need for these solutions come from. So think about it. This is that time in a woman's life when the sentiment of immense joy, it coexists with a lot of self-doubt. There's a lot of apprehension that women face, right? And at least personally speaking, I don't know a woman who did not feel overwhelmed in these times, especially birth of the first child, right? So from nappies, feeding, distorted sleep routines, and very significantly, I think all women on the call would agree with me that not so helpful self-talking that we all as women do, right? Am I feeding मैं बच्चे को पूरा दूध दे पा रही हूँ? Look at me, कितनी मोटी हो गई हूँ? Will my curves ever come back? Right? Oh, my stitches hurt when I feed and keep sitting for hours and hours, right? So basically, she's grappling with so much, and you know that in all of this grappling, she is trying to do her best. So the thought behind getting the solutions that we as Ethicon work upon is so much going to that aspect of her life where we want her to really be the best version of herself in terms of helping herself, her baby. And the last thing that we would want this new mother to think about is worry about contracting, for example, an infection, or going back to the doctor again and again thinking her stitches are not healing well, her wound is not healing well, right? Not be able to get back to the baby in a clean fashion after taking a shower, right? And one example you referred to. So let me dwell on a bit of detail here. Do you know that in spite of all the best infection control protocols that your doctor is going to follow, the risk of developing an infection after surgery during your C-sec is not eliminated? And Dr. Niraj will agree with me, right? And while your doctor does the right thing by putting you on all the write oral antibiotics after surgery. At Ethicon, we thought that what if we coat these stitches or these threads or these sutures, as we call them, with an antibacterial or an antibiotic coating. And guess what? Just with that innovation, we're able to inhibit the bacteria getting formed around that layers of wound, those 3 layers of wound that need to be now stitched up for 7 clean days. So much that your body needs at that point, right? And then what does it translate into? What it translates it into is that number of these kind of infections actually reduced by 1/3 when you do something as simple and basic as that. More importantly, Dr. Niraj spoke about 3 or 4 days of recovery period before the mother can go back home. It can even be faster with stitches like this. Another example, something that you asked me specifically. And good if I can have a raise of hands on the meeting room. How many of the mothers would want to shower immediately after surgery and hold the baby clean in their hands? How many of us as mothers on the call would not want any stitches and want minimal scars after C-section? How many of us would want our wounds to be absolutely infection-free? Obviously, all of us, right? And this is where, I call it the magic glue. I mean, sorry for using that lame example, but it's actually like any other adhesive or for example, a Fevicol that you would have, right? So the skin adhesive system, we call it the Dermabond Premium, that provides minimally invasive closure. So you have no stitches, you have no holes in the skin, you have no stitching. You simply apply that gel and the wound closes on its own. What it does for you, it reduces the chances of infection. Yeah. You can go back home sooner. There's easier self-care. You can take showers the same day. But of course, over to your doctors and Dr. Niraj here to share more details. But I think at Ethicon, we're committed to bring in these kind of innovations that are designed to provide improved outcomes for the mother, prevent her from infection, enable her to provide the best care for her kid and herself.
I mean, I think it's absolutely fascinating. In fact, that's why I want to, take the next maybe couple of minutes just to understand from Dr. Niraj, because he's a gynecologist, right? And I think for me, it just sounded like such an amazing improvement. Like I gave birth 2.5 years back, right? And I did not know of this development. I mean, I went to the best hospital, had the best gynac, probably like in my head, right? The one I could afford or the one I had access to in Bombay. And I did not know that I could actually glue up my stitches, glue up my scar, and like not have a scar at the end of it all. I mean, we are going to be living for the rest of our lives with this. So, Dr. Neeraj, just from your experience, have you already been using this? What has your experience been? Does it tell us a little bit more about what it feels like for us as women and what it feels like for you as a doctor to be applying this in the first place?
So it was very interesting to listen to Vandita about the glue which she mentioned about. The 3 things actually when you talk about your as a patient when the woman is recovering, the 3 things. 1, inherent surgical technique, the way the surgeon has operated or dealt with the tissues. The general tissue respect is what we say. So if you have a good surgical hand, your surgical outcomes are good. That is one important thing. So when you say about your gynecologist or your general surgeon or anybody who's operating on you, one of the most essential things apart from the suture materials and the adhesives, which are also important, is how the person doing the surgery is one. So leave that aside. That's too technical. Now coming to the sutures, Vandita, absolutely, and I endorse it again completely, about the suture materials which have come these days, which are antibiotic coated, and more importantly, they're very easy on tissues. They hold the tissues nicely with very less what we call in technical terms. Sorry, I'm not making medical jargon here, but we call it foreign body reaction or which means any foreign item. Here it is the suture material which your tissues have to deal with. They're very gentle on tissues, these new suture materials which are there. Now coming to the specific question about this glue which Vandita mentioned about, the beauty of it is obviously you can take shower without worrying about the wound dressings getting soaked. One of the most standard instructions wherever you go, I would say almost, if I'm not exaggerating. 99% of the doctors, when you have surgery, one important instruction they'll say is don't wet your wounds for 3 or 4 days. That's a very standard. 99 is still an underestimate. Maybe 99.5% may be saying don't wet your wounds because it might get infected. And there will be good set of women. I imagine in the audience here of whatever 250 or 300 people who are attending this, I would imagine there'll be many women, which probably Harpreet will agree with, saying that she would want to have shower almost immediately or the next morning. Once she feels physically fit enough to walk to the shower, she wants to have the shower. Now, these kind of glues will definitely help, and it's a step forward towards those kind of women who are wanting to do these kind of things, and what we call again enhanced recovery, which means you just want to come out and be as normal as possible, as quickly as possible. So that kind of glue definitely helps. I've been using it in my practice and it has worked beautifully well. Most of the surgeries which I do also are endoscopic surgeries. That's my first love, as I say. I mean, obstetrics is, of course, but minimal access surgery is what I do a lot. And all those laparoscopic surgeries which I do, we do use these kind of waterproof dressings, gels, which actually help women to recover very quickly. So I'm very happy having those kind of things in my armamentarium.
And Harpreet, I want to come to you very quickly, and then we should open it out for questions, right? I mean, I saw your reaction when you heard about the glue yesterday. I mean, day before yesterday as well. We were on the same call, right? So what comes to mind now? I mean, like, what would we do differently? I mean, I'm just thinking about it. I would go to my doctor and basically just ask, like, do you have this option available for me if I decide to have a second child? That's going to be my first question. But like, what comes to mind for you when you think about this?
फिलहाल तो मैं सोच रही हूँ कि third कर लेती, because it's so easy. If it is so easy of what I've been through, it would have been great. And because doctors saying it, and I've heard it, from your own mouth at BabyChakra, with Ethicon doing this, I have a lot of faith in it, and I would really want to go out and tell a lot of women about it, because it's only you know your pain. So only I know my pain, of lying on that bed and feeling really bad about my own self. So I'm glad something like this came by, and हाँ मैं भी अब डॉक्टर से पूछूंगी अब ये है, so मैं third कर लूँ, and doctor I'm going to come to you this time.
Come down to Hyderabad.
And I'll have a delivery with you. So yes, I'm very, very happy about this new innovation that's come by. So lucky all these girls are here
and
who are going to use it now.
So they'll get to know. Yeah. And Dr. Niraj, just one last question. Does it leave a scar? Like if we use the glue, does it leave a scar like stitches do?
It will be there, unfortunately. It's not the scar. Scar will always be there, no matter. Once you have cut on your skin, it's never going to be a virgin skin again. It's going to be a scar, no matter how beautifully someone has stitched it. But I'll tell you what, again, it depends upon the stitching skills and the suture material which is used. I have seen many, many women who you have to find the scar on the tummy. You have to say, did you really have cesarean section in the past? I can't see the scar. So the best scars I have seen is which appears like a tight elastic band, and you just have to kind of tease it a bit to see it's actually scar. So that's the best healing. But yes, scar will be there no matter what. I mean, we say scarless surgery. Scarless is not really truly scarless. Once you have a cut on the skin, it's going to be there for life.
Got it. That's very helpful. So I know we have lots of questions. So I'm going to just take the ones and Parvi, tell me, I'm taking the ones on the WhatsApp that you've been sort of shortlisting and sending, because I know there are lots of other questions. Yeah. So the first question is, the skin above my stitches still pains sometimes, and it's been 18 months after delivery. This is from one of our moms. I guess Dr. Niraj, that's for you, or unless Harpreet and Vandita have some more practical advice to give. Either way.
I was just checking my stitch when I heard that question. I was checking. Is it still there? Once a mom, always a mom.
Yeah. So sorry, Vandita, do you want to go?
No. Please go ahead.
Sorry, what was the question? Someone has said that she had a cesarean section and still has a painful scar.
That's so the skin above my stitches still pains sometimes, and it's been 18 months after delivery.
Right.
So the skin above the stitches.
I'll tell you what, it's difficult to really advise purely on this kind of forum without actually having a look at it, because there are certain women, men as well, or human beings as such. We all have, there's some who have a tendency for what we call keloid formation, which means the scar just heals in a very ugly way. If I can use that word, ugly, I'm sorry using that word, but it just doesn't heal properly. That's called keloid, which means someone had, that's the way someone's wound heals, no matter what. who does it, what the person has used, it doesn't matter. It becomes immaterial. So one will have to have a look and see actually what it is. And there will be some women who may, I mean, again, what kind of suture material they have used. If they have not used dissolvable material, for example, there are still some doctors who may be using non-absorbable, what we call, which means they will not dissolve in the body even after many years. So those women may feel the pain in the scar. So I'll have to look into the details about what kind of scarring, what kind of suture material, and how it looks like. And most important, how does it feel clinically when I touch it, for me to be in a position to say what possibly could be the reason behind it.
Very helpful. I want to go to the second question. I think this comes back to, Harpreet raised this. I mean, I think we all sort of face this. After C-sec, I faced a lot of back pain. Is this normal? I have taken some medicine. Please give some advice. And, doctor, I mean, all of us have basically understood that our spine curve, all of this other stuff. But like, what does she do now? Because she is facing this back pain. And it's after her C-sec. Any advice from any of the panelists here? I think, doctor, it's everyone wants your time, it sounds like.
I know.
So in case
Doctor,
you
you
have
have to answer this, but I have one thing to say. I've been through this, and everybody told me it's because of my epidural. No. That's why, doctor, I wanted you, from the horse's mouth, that you say that it's not because of epidural. I realized I had put on a lot of weight. And once I started exercising, after about 1.5 years of having my daughter, that's the second time, I started walking, I started running slowly, I started cycling. I became more mobile, and my back pain really hit, and my vitamin D was very, very low. So these two things I fixed, and my back pain was gone. Rest, doctor will tell you.
I'm happy Harpreet touched upon.
Very interesting.
It's very important. Vitamin D, which she said, is very important, because most of the Indians these days, we are realizing, are very less in vitamin D levels for whatever lifestyle we have adapted. Now, I already mentioned, I don't want to go into technical details, causes damage to the back. But what this lady, physiotherapy, see a not an orthopedic surgeon, but do some back exercises, and gently, as Harpreet also shared the experience of doing some exercises in form of walking, running, cycling, and then looking at your vitamin D and calcium levels, that might help, because all these women, I'm assuming, are very young mothers or would have been mothers recently. So these women don't have any chronic, which means long-standing bone problems in terms of osteoporosis and all those things. So these are the women who are either deficient in vitamin D or calcium, or just have not recovered fully from their pregnancy and the effects of pregnancy. So most of them do need some physiotherapy who can guide them properly in lower back exercises, upper back exercises, and that should really be the answer, I guess. But don't please make a habit of taking painkillers. Don't please take painkillers on and on, because those also on a long term have cumulative disadvantage.
I think that's a very important point, and I think I love the advice in terms of the mild but regular exercise. I think that has been one of the best ways for personally me as well to get back on my feet post pregnancy. Like really just pulling myself up and saying, let's just do short walks in the house in the first go, and then out of the house, and of course now in COVID, like in the house again. But nonetheless, I think that really makes a big difference. There's a question around.
Can I just add a dimension to that, and maybe that's going to help some moms to be here, and the ones that are just
absolutely.
Yeah, so I think what I want to add there is that exercises, but very carefully chosen exercises are important, because not just for a back pain perspective, but also to ensure that the uterus comes back to its original position. So that's an important one for a relevance of exercise standpoint.
Very helpful. I think an important angle to this as well, which many people tend to overlook. I think a couple of other questions. I was pregnant 5 years ago and got C-section, and still feel numbness on the stitches, and feel less pressure in the bladder. Wow, I think comes back again and again to like just how the procedure is done, right? And the impact later. But any thoughts there, Dr. Niraj or Vandita? Is this normal? Is this something that they should go to the healthcare provider on, to the doctor back on? I'll repeat the question. I was pregnant 5 years ago and got a C-section. I still feel numbness on the stitches and I feel less pressure in the bladder.
Right. There are two different aspects. One, numbness in the skin. Now, numbness, I'm assuming what she's saying is numbness in the area where she had a cut on the skin. Now, if that is where numbness is, I would ignore it. I learn to live with it. I'm saying that simply because A, it is not a disease. It is not something which can be treated. I'm saying this because when we cut the skin, the fat, muscle, sheath, whatever tissues we come up, there are layers in the body which we have to cut until we reach the baby. Now, nerves are take a lot of time to regenerate. Like skin heals quickly. You can see the skin has healed, approximated nicely. But nerves do take a lot of time to heal, regenerate. They may regenerate in a random fashion, and you might be left with that area of numbness. If it's not causing you any great deal of harm, which I'm assuming it wouldn't, because a small patch on the skin feeling numb shouldn't be a big problem. Second issue which you're saying is about the bladder problem, about urine difficulty or whatever. I don't think that is connected to your cesarean section. Now, most women, unfortunately, I have seen, they have anything, they would try and connect it back to the cesarean section or epidural. They have headache, they connect it to epidural. They have backache, they connect to epidural. They have tummy pain, they connect to cesarean section. So that is not how it is. 5 years down the line, after your cesarean section, everything in your body has healed as far as cesarean section is concerned. So please don't connect everything you have to cesarean section, including the bladder problem. I'd imagine this bladder problem which you're saying is a completely independent problem in itself. I would advise you to go and see not a gynecologist, but a urologist who's a bladder doctor, or kidney, urine, bladder, those kind of organs they deal with. So I would advise you to go and see a urologist. And please don't think it's just to do with your cesarean section unless proved otherwise.
Got it. And I think that's linked to, a couple of other questions, that after the cesarean, the belly of mothers increases a lot, and sometimes the weight also increases. What causes it?
I'll tell you what, I don't want to name the celebrities or stars here, or I can see two of them in my panel here, or three of them, who have had kids, and I'm assuming they don't have a big tummy or they're not overweight. What I'm trying to say is, it again depends on how you look after yourself, how you look after your back and tummy after having had the baby. And there are lots of celebrities or film stars which you can who have come back to normal shape or which they had prior to pregnancy. So it's not to do with pregnancy, it's to do with how you cope with the effects of pregnancy after you've had your baby. Which means, again, you have to do some exercises, you have to look after what you're eating, and you have to look after your back. So back exercises, tummy exercises, and your diet. And perineal exercises. And again, it's too intimate for me to kind of explain what those kind of exercises mean, which your physiotherapist might help you. And
yeah, I want to add something here.
We have a very nice and vociferous participant. Hi, whoever it is. But yeah, let's move over to Harpreet. Yes, Harpreet, what did you
I
want
want
to
to
say?
say something to moms here. So when I had my first one, I came back to shape and became much more skinnier than I was ever. I was very hard on myself. I was dieting, I was exercising, I was in this race, with society, I think. With my second one, I have not come back to my normal weight, and I don't think I will, because I love food. I very moderately exercise. I don't want to starve myself. And I've accepted my body the way it is. I love for what my body is. Please don't put yourself under this scanner or any pressure or thinking what others are going to think. You're very beautiful. You've given birth to another. You got something. You got life in this world, which is the biggest thing anybody. It's like God. God gave that to you, to be blessed to bring life to the world. So please, I want to tell a lot of moms this: don't put yourself under scanner all the time that I'm not that weight that I was. It's okay. It's all good. Just love yourself and slowly do whatever you do.
I think that's a very important perspective. And I think, we actually on BabyChakra, we see that a lot because, mothers are just constantly judging themselves, right? And it's tough because, your body's just gone through so much change, and emotionally and mentally, you've just gone through so much change. So absolutely, I mean, let's not be harsh on ourselves, right? Because unless, we are happy, it just boils down to our internal happiness, right? So I think we just have to ensure that we know that what we have done is amazing, is truly a miracle. And our body has just produced another living being, so it'll obviously take time to come back to a state that you're most comfortable in it, right? So absolutely agree with you there, Harpreet. I know we're out of time, but I just want to ask this question. My sister's pregnant with 7 months pregnant, and I want to know, can she choose to go for a C-section even if she's able to give normal birth to baby? Because we don't want to spend much time in hospital due to the current pandemic. It's a very interesting question. What is the what is the thought here then? Like, how do we respond to this, doctor?
Very nice. Yeah. Again, I split it into two halves, this question. One, about the choice of birth. Second, on the reason for going for cesarean section. If you look at these two aspects independently, one particular lady wants to have a cesarean section, that's a choice. Now, unfortunately, there are quite a lot of women I'm seeing in this part again in Hyderabad where I'm practicing in the high-tech city part of the city. Wanting to have cesarean sections for multiple reasons. I don't want to go into those details, which in a way makes one feel sad because that's not how a natural birth is meant to be. You can try for a natural birth, but again, we empower women to take their own decisions and kind of include them in decision making, include the couple in decision making, talk to them about pros and cons about natural birth, pros and cons of cesarean section. That's a different debate. Now, the issue I think here at hand is about the pandemic. As far as time you spend in hospital is concerned, yes, the more time you spend, the more likely you may get infection. But that's I think that's a myth to a certain extent, because if you're taking the right precautions and you go to the right hospital, where like we are in a COVID hospital, we have a COVID branch elsewhere. COVID patients. The moment someone is COVID positive, we send to some other hospital, our own hospital in another area of the city, and we deal with it there. So that does not guide people to make decisions, which has lifelong impact. Cesarean section, one cesarean section puts you at a risk of having second cesarean section. Harpreet will tell you that. So once you have a cesarean section, second cesarean section chances are massively up. So you are not only for a short-term gain, you are putting yourself at a long-term risk of having had cesarean section in the past, which makes you have cesarean subsequently, and maybe thereon. So I think that's a very short-sighted thing. If you take due precautions, your hospital, I'm sure, will take precautions. You don't get COVID. We come to hospital every single day for last 18 months. Fortunately, we didn't get COVID. I'm not saying anything that we may not, we will not. But point is, we've been doing the right things. We've been taking precautions, and we have protected ourselves. So have my colleagues. And so do we. We are equally responsible for looking after patients as well. So all these women who come to us, we make sure that they are kind of treated the way we look after ourselves in avoiding getting COVID.
Got it.
Short-term, short-sighted decision, which I don't think is justified. But it's a personal choice again. You're empowered.
Got it. So, I think we're really out of time now. I think Harpreet predicted this. She's like, we will not finish in an hour. So anyway, we're out of time. I just want to close with a very quick rapid fire. So to all the three panelists, amazing panelists, one word to describe motherhood and one word to describe innovations that improve the journey of motherhood. Dr. Niraj, we're going to start with you.
Fatherhood.
Fatherhood, okay.
I would say it's been most satisfying, and being an obstetrician, the one thing which I did was when I was having my second child, my daughter, who's now 12-year-old, when my wife was having cesarean section in St. Heliers Hospital in London, the team there did not know I'm a fully accomplished obstetrician by then. I was sitting there as a husband of a patient, that's all. I was a husband, and nobody in the operation theater knew that I was a fully trained obstetrician. But all I knew from the midwives was where the gloves are and where the instrument is to get the baby out if the baby is stuck. Because although I was sitting there as a husband, if there was a problem, I would have just jumped in and I would have got the baby out. The midwife outside knew that I was there, but the team inside did not know that this gentleman is an obstetrician. I was far senior than the person doing the surgery, but I was alone, because the moment you try to be a VIP or a doctor, things will happen to you. So just be a common man. It will work out for you, but be prepared that you might have to jump in if there's a problem. So my one word is satisfying.
Got it. Awesome.
of course, innovations, I would say improve your surgical skills every single day. We're still on a learning curve. We're still learning. No matter what, I'm on a learning curve of my own, and it's still going up.
Awesome. Harpreet, over to you. One word to describe motherhood and one word to describe innovations that improve the journey of being a mom.
Motherhood is phenomenal. It's liberating for me. Just liberate. See, I changed my career once I became a mom, so it's liberating. It liberated me. And these innovations, yeah, they're magical. I wish. Third to nahi karungi, doctor, मैं ऐसे ही मिलने आऊंगी आपसे. But yeah, they are magical. They're magical for the women of today.
Yeah, awesome. And Vandita, over to you. Last word. One word to describe motherhood and one word to describe innovations.
Motherhood, selflessness, innovations, vital.
Yeah, I'd agree with that. I think it's really important. Vital.
Vital, yeah, sure.
Innovation is vital.
Yeah,
it's vital. I fully agree with that, actually. And, with that, we come to a close on this panel. I just want to quickly, again, summarize by thanking all the panelists. It's really important we bring, and we do a lot of these webinars, but also sort of live chats and Chai Pe Charchas on BabyChakra, I think all of you know. But the reason we do it is because, the idea is that go out and ask.
Oh, she has disappeared.
She will magically come back.
Is Gauravi here? Gauravi?
Gauravi is here.
Yeah.
Yeah, hi. I'm just checking, I guess. Give me a minute.
This was an insightful session, I must say. So insightful. So much to learn from everybody.
No, I learned today from both of you, three of you. I said both because Vandita and Harpreet, you shared your experiences in a real way.
Dr. Epidural is my pain point because I see every day women talking to me about their mother-in-laws, husbands, everybody saying that injection nahi lagana hai bas. And I feel women, बेचारी कुछ बोल नहीं पाती औरत और कोई लगाने नहीं देता उसको. That's why I wanted, from you that what is your thought on it. ये बड़ा सोच लो मेरा pain point है ये. मैंने बहुत women देखी है who've been crying that मुझे लगवाने नहीं देते because backache.
Yes, Naya is here.
Oh, hey, Naya is back.
Sorry.
Yeah.
I clearly got too excited and I went off. But I just wanted to also quickly close with saying hi to some of the little babies that I've seen, Annie, Anubha, I've seen Meena's little baby. And they're just adorable because through this entire conversation, right? This is the reason we all exist. It's the reason we're doing these conversations. Because you want to sort of see more of these little amazing faces on our screen. And so thank you all for making time. And please stay safe. And there's a really little baby with Sakshi. Sakshi, is that your baby in the cot? Oh, Nad's iPhone. Okay, but lots of little faces. So everyone, please stay safe. It's a tough time, I think, in the world. It's a time that we will power through and be stronger together on. So stay safe and thank you very much for making time. All right, thank you all. Thank you all to the amazing panelists.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.